Hi everyone, my name is Sylvia Garcia and today I will be discussing healthcare reform specifically pertaining to the integration of healthcare. I want to start off by defining the problem. Currently, our healthcare system presents with a serious gap in the provision of services to those with severe mental illness in comparison to the general population. According to numerous literature reviews, in the United States, this in part derives from systemic separation in the provision of public mental health and general health care. For the past 2 decades, there has been ongoing research that has shown the benefits of integrating mental health and primary care. In essence, integrated health care is a patient-centered approach in which behavioral health and medical providers work together to provide care. The benefits of this approach are accessible healthcare services, improved quality of care, and lower overall healthcare expenditures. The integration of healthcare is a pivotal change within our healthcare system and promises to improve the lives of many. Currently, it is estimated that 9.6 U.S. adults have a serious mental illness. Individuals with SMI or substance use disorders have higher rates of acute and chronic medical conditions, which leads to a shorter lifespan expectancy by an average of 25 years. This population also have higher utilization of emergency and inpatient resources, resulting in higher costs. The rationale for government involvement in resolving this issue is clear. There is a dire need in our healthcare system to improve healthcare outcomes and control expenditure, especially among the SMI population. According to the Baseline Center for Mental Health Law, patients with psychiatric disorders are likely to use the emergency room on multiple occasions and have multiple hospitalizations compared to patients without psychiatric disorders. Many times these visits are non-emergent health issues, for example, an ear infection or the common cold, and can be addressed by a primary care physician without the need of emergency intervention. The disconnect between providers, in addition to the lack of preventative health care services for SMI patients, often leads to the overutilization of the emergency room, subsequently resulting in high expenditure and poor health outcomes. The Baseline Center for Mental Health Law further states that 1 in 8, or nearly 12 million, emergency room visits in the United States in 2007 were due to mental health and/or substance use problems in adults. Of these, 63.7% were related to mental health problems, while 24.4% involved substance use disorder and 11.9% involved co-occurring psychiatric and substance use disorders. There is a possibility that these alarming numbers of emergency room visits could have been substantially diminished through early detection of symptomology and preventative care. On March 23, 2010, President Obama approved the Affordable Care Act. This act includes provisions that shift the U.S. healthcare system to address achieving wellness rather than just treating illness. The Affordable Care Act has created opportunities for improving prevention of mental illness and promotion of mental health. These include improved coverage of preventative services and models to integrate. Currently throughout the nation, the implementation of this healthcare reform is taking place. In our state, there are a substantial amount of behavioral health agencies who are fully integrated and others that are still working on making the shift. This policy has gone through the policymaking process in its entirety and is now in the implementation stage. There are many groups and institutions that have an interest in addressing the systemic problem our healthcare system currently faces and that support the integration of healthcare. For the sake of time, I will only focus on those institutions that directly influence the implementation of policy within our healthcare system. In our state, the Arizona Department of Health Service Division of Behavioral Health is responsible for serving as the single state authority to provide coordination, planning, administration, regulation, and monitoring of all facets of the state public behavioral health system. This institution then contracts with community-based organizations known as Regional Behavioral Health Authorities, or REBAs, to administer behavioral health services. REBAs then contract with a network of service providers similar to health plans to deliver a range of behavioral health care services and treatment programs for individuals with severe mental illness and/or substance abuse. It is the REBAs that oversee the implementation of policy and provide funding to those agencies who comply. The success of integrated healthcare will greatly depend on the REBA's ability to properly regulate and monitor the implementation of such policy and ensure proper funding is available to sustain the change. The integration of healthcare is a complex process that is experiencing many unforeseen barriers. Integrated healthcare providers will have to overcome many obstacles before seeing desired outcomes. But if implemented correctly, integrated healthcare will significantly improve health outcomes and reduce healthcare expenditures in the United States. I hope you enjoyed the presentation and gained knowledge of the change that is currently occurring within our healthcare system.